students, welcome to MOOC's program on plasma volume expanders. So, this is topic of unit 2 of subject Pharmacology-II and the subject code is BP503T. So, myself Geetika Mehta, assistant professor in pharmacology at Rajkumar Goel Institute of Technology, Pharmacy, Ghaziabad. So, to begin with, first we will understand what is plasma volume expander. So, in this we will understand complete pharmacology of plasma volume expanders, what are the ideal properties of plasma volume expanders, what is the significance that is use of plasma volume expanders and what are different types of plasma volume expanders. So, plasma volume expanders, they are the intravenous fluid solution which increases the plasma volume by increasing osmotic pressure. So, these are the solution which injected, which when given intravenously, they increase plasma volume by increasing osmotic pressure. It is also clear from its name, plasma volume expanders, that is the agent which increases plasma volume, These are high molecular weight substances. They are generally used to replace fluids that are lost due to illness, burns, trauma or hemorrhage. In emergency, immediate volume replacement is important to maintain the blood pressure and tissue reperfusion. So, whenever there is a loss of blood, either there is a loss of blood or even the plasma loss. Loss of blood occur like in the hemorrhage, plasma loss occur like in the burns. So, that loss component should be replaced immediately, because loss of the blood will reduce the blood volume decreases, blood pressure decreases. So, heart will not be able to pump sufficient blood to the tissue. So, hypoperfusion of the tissue will occur. Reduced functioning of the cell and tissue, and that will lead to the hypovolemia because reduced oxygen supply. So, that will result in the hypovolemic shock. So, to overcome this, the loss component, whether it is blood or whether it is plasma, should be replaced immediately. But if in the emergency blood or plasma is not available, then we use plasma volume expanders. So, plasma volume expanders will increase the blood volume, thus they will increase the blood pressure and thus oxygen will reach to all the tissues, and that will result in the prevention of the shock, that patient will not go under the shock. So, whenever the blood is lost, greatest immediate need is to stop further blood loss, and second greatest need is to replace the lost volume. Why? Because blood volume is directly proportional to blood pressure. When both decreases, when there is decrease in blood volume, when there is decrease in blood pressure, then flow of the blood to important tissue may be inhibited. Flow of the blood to important tissue may be inhibited, and that would result in reduced oxygen supply. To the tissues. So, hypovolemic shock will occur. When tissue oxygenation drops due to decrease in blood volume. So, plasma expanders, when infused intravenously, they retain fluid in the vascular compartment and thus correct hypovolemia due to loss of plasma or blood. So, plasma volume expanders, they are when they are present inside the blood vessel, they will increase the blood volume. Increase in blood volume will increase the blood pressure, increase in blood pressure will result in the increased perfusion of the tissue, oxygen supply will be improved, and thus the patient will not go under the shock. To understand this, we first need to understand distribution of total body water. So, 60% of the body consists of water, out of this 33% in the present as the extracellular fluid and 66% present intracellularly, that is inside the cells, blood cell, bone cell, muscle cell, etc. Out of this 33 extracellular fluid, 8% is plasma present inside the fluid, present inside the blood, 8% is the plasma, rest 25% is interstitial fluid, that is present outside. This is the interstitial fluid present outside the cell, interstitial fluid, interstitial fluid. So, this is the fluid between the cells, lymph, GI fluids, cerebrospinal fluid, fluid in the eyes, aqueous humor, vitreous humor, tears, synovial fluid, these are all types of extracellular fluid that are present. So, this makes 25% and rest 8% of the extracellular fluid is blood plasma. You all know what are the different components of the blood. Blood is a fluid connective tissue made up of plasma and solid components and circulate continuously around the body. Plasma appear as a straw colored fluid. So, 55% of is plasma, that is straw colored fluid is composed mainly of water, but also carries ions, proteins, dissolved gases, nutrient molecules and waste. The number of proteins present in plasma, they include antibodies, coagulation factors and albumin, fibrinogen and maintain serum osmotic pressure. So, these are the different components of the blood. You have already seen red blood cells, platelet, white blood cells and the plasma. So, now what should be the ideal properties of plasma? So, plasma volume expanders, ideal properties of plasma volume expanders. So, they must exert oncotic pressure comparable to plasma. What is oncotic pressure? Oncotic pressure is colloidal osmotic pressure that is exerted by proteins present in the plasma. Which protein? Mainly albumin. The oncotic pressure is the colloidal osmotic pressure exerted by the plasma protein, mainly albumin, and that causes the inflow of water into the blood vessel. They should remain in the circulation and not leak out in the tissues. They should be longer acting, pharmacologically inert, that is they should not exert any action of its own. It should be stable, easily sterilizable and cheap. Plasma volume expanders should not interfere with the grouping and cross matching of the blood. They should be non-antigenic, that is they should not produce any allergic reaction. It should be non-pyrogenic, that is they should not increase body temperature. So, these are the ideal properties of plasma volume expanders. Next is, what are the different types? Different types of plasma volume expanders are colloids and crystalloids. Colloids are dextrans, gelatin, hydroxymethyl starch, polyvinyl pyrrolidine, human albumin and blood. Blood is also a colloid. Crystalloids are normal saline, dextrose and Ringer solution. So, crystalloids are aqueous solution of mineral salts or other water soluble molecules. Crystalloids are aqueous solution of mineral salts or other water soluble molecules, while colloids are larger insoluble molecules. Colloids are larger insoluble molecules. Colloids are longer acting. Colloids are longer acting as compared to crystalloids. The larger molecule of colloids are retained more easily in the intravascular space and increases the osmotic pressure. So, they are more efficient than crystalloid. Colloids are more efficient than crystalloids because they retain for longer duration and increases the osmotic pressure, but they are more expensive than crystalloids. Next, going further is mechanism of action. How these plasma volume expanders act? What is their function? To increase plasma volume. But how will they increase plasma volume? So, plasma volume expanders, they work on the principle of osmosis. They work on the principle of osmosis. They increases plasma osmotic pressure, increases plasma osmotic pressure, draw water into the plasma. They draw water, this is blood vessel, this is plasma present inside, and these are the interstitial spaces, that is the interstitial fluid, that is fluid present outside the cell. So, it will draw because of the osmotic osmosis, water will enter inside the blood vessel and that will result in increase in blood volume. So, they act on the principle of osmosis, they increase plasma osmotic pressure and they will draw water into the plasma from the interstitial fluid, and prevent it from the leaking out into the tissue, and thus they increase intravascular blood volume. Since the lost blood is replaced with the suitable fluid, the diluted blood flow more easily. So, diluted blood flow more easily. So, tissue reperfusion will be improved, oxygen supply will be improved. So, it will increase central venous pressure, it will increase cardiac output, increase in stroke volume, increase in blood pressure, increase in urine output, and thus it improve oxygen flux. But it decreases heart rate and decreases blood viscosity. It will decrease heart rate and it will decrease blood viscosity. So, this is mechanism of action of plasma volume expanders. Plasma volume expanders basically work on the principle of osmosis. They draw water from the interstitial fluid into the plasma by increasing the osmotic pressure, and thus inside the blood vessel they increase the blood volume. Because of increase in blood volume, there is increase in blood pressure. Because of increase in blood pressure, tissue reperfusion will improve, oxygenation of tissue will improve, and thus they will increase the cardiac output and urine output. So, what are the uses? So, plasma volume expanders, as I told you, whenever there is a loss of the blood or plasma, so we need to substitute it in the emergency. So, immediately, so they are used as plasma substitute in hypovolemic shock, burns and in extensive fluid loss as an emergency measure to restore plasma volume. They can also be used as a temporary measure in case of whole blood loss till the same can be arranged. What are the contraindications? Plasma volume expander should not be used in case of heart failure, severe anemia, pulmonary edema and in renal failure. Now, we will do one by one. So, there are the two types as I have told you, colloids and crystalloids. So, first we will cover drugs of colloids and then we will cover crystalloids. So, colloids, these volume expanders, they contain large insoluble molecules such as gelatin or hydroxyethyl starch, and theoretically they increase the intravascular volume, but not interstitial and intracellular volume, because they do not go out, they cannot cross the capillary membrane. So, they retain inside the blood vessel. So, remaining inside the blood vessel or they have longer duration of action, thus they increase the intravascular blood volume. So, colloids are larger insoluble molecule, increase the intravascular blood volume. They do not go out, they do not leak out. So, blood itself is a colloid. Commonly used colloids are albumin, dextran and starch. Now, what are the advantages and disadvantages of colloid solution? So, advantages, as I told you, it has longer duration of action. Colloids, they have longer duration of action, replaces fluid volume for volume, that is, in colloids large amount of colloid is not required, it replaces fluid volume for volume, equal volume is almost required, large volume of the colloid solution is not required, and as they have high molecular weight and their permeability is low. So, they cannot cross the membrane of blood vessel, capillary membrane. So, they stay for longer duration. Disadvantages: colloid solution, they may produce allergic reaction and they have various effects on blood coagulation. Excessive use of colloids can precipitate cardiac failure and they are expensive than crystalloid solutions. So, this we have already told colloid solutions. So, these are the larger molecules, they have high molecular weight, their vascular permeability is low, they stay for longer inside the blood vessel, thus they increase the blood volume, they do not leak out and they are not required in large amount, they replaces fluid volume for volume and they have longer duration of action, and these are their disadvantages. So, first in this is dextran. Dextrans are polysaccharides that are obtained from sugar beet and is available in two forms: dextran 70 molecular weight 70,000, dextran 40 molecular weight 40,000. Dextran 70 more commonly used colloid, its osmotic pressure is similar to plasma. Its osmotic pressure is similar to plasma. It expands plasma volume for nearly 24 hours. It expands plasma volume for nearly 24 hours, slowly excreted by glomerular filtration as well as oxidized in the body over weeks. Allergic reactions, they are quite common with dextran and it may interfere with coagulation, blood grouping and cross matching. So, dextran, as I told you, it is of two types, 70 and the 40 depending upon the molecular weight, and this is quite commonly used plasma volume expanders which is of type of colloid. Next is dextrin 40. It is 10% solution of dextrose and saline. It is faster acting, but shorter duration of action. Faster but shorter duration of action. It reduces blood viscosity and prevents RBC sludging. So, it improves microcirculation. It reduces blood viscosity and improves microcirculation. They are rapidly filtered at the glomerulus and may get highly concentrated in the tubule if oliguria develops. Oliguria is decrease in the urination, reduced urination. So, rapidly filter at the glomerulus, so may get highly concentrated in the tubule if oliguria develops. So, tubular obstruction may occur because of this. So, this may lead to tubular obstruction, but these are cheap and can be stored for 10 years. Next is this. Next colloid is degraded gelatin polymer, also known as polygylene. See, this is synthetic polymer of molecular weight 30,000. It exerts osmotic pressure similar to albumin and is not allergic, that is, it has no antigenic properties. So, it does hypersensitivity reactions, allergic reactions are very rare with this. Does not interfere with blood grouping and cross matching. These are used for priming the heart, lung and dialysis machine. Its duration of action is 12 hours and it has longer shelf life. Next, other commonly used colloid is HETA starch, that is hydroxyethyl starch. It is complex mixture of 90% ethoxylated amylopectin of various molecular sizes. Average molecular weight is 4.5 lakhs. It maintains blood volume for longer time. It maintains blood volume for longer time. It does not cause acute renal failure or coagulation disturbances. So, it is better colloid. So, it improves hemodynamic status and stabilizes blood volume for 24 hours. So, HETA starch, it maintains the blood volume for the longer time. So, it improves hemodynamic status, stabilizes blood volume for 24 hours. So, this is again one commonly used colloid, plasma volume expander. Adverse effects are fever, chills, vomiting, anaphylactic reaction and urticaria may occur. So, next is this is polyvinyl pyrrolidine. This is synthetic water soluble polymer used as 3.5% solution. Fraction of PVP is stored in reticuloendothelial cells, Kupffer cells and liver, skeletal muscles and skin for a longer time. They are partially excreted through kidney. Polyvinyl pyrrolidine binds penicillin and insulin in the plasma. They are not preferred because one thing they are synthetic polymer and other, that is they interfere with blood grouping and causes histamine release. So, because of this histamine release, they will produce antigenic, they will produce allergic reactions. So, next is human albumin. Human albumin is obtained from pooled human plasma, given as 5% or 20% solution. 100 ml of 20% solution is osmotically equivalent to 80 ml of whole blood. It is non-antigenic, does not interfere with coagulation and blood grouping, free of the risk of transmission of hepatitis because the preparation is heat treated. Though expensive, it is expensive, but it is quite effective colloid, and this is quite useful, and but so it can be used in burn, hypovolemic shock, hypoproteinemia, acute liver failure, and in dialysis. So, human albumin, albumin as we know, it is a protein present in the plasma. So, human albumin is the function is same, that is obtained from the pooled human plasma, and it has advantages. It is neither antigenic nor it interferes with the coagulation and blood grouping. It is free of the risk of the transmission. So, this is quite effective plasma volume expander. Next is crystalloid. Crystalloids, these are electrolyte solution with small molecules that can diffuse freely throughout the extracellular space. Relatively low tendency to stay intravascular. So, colloids, they stay longer time in the blood vessel, but crystalloids, they have tendency to leak out. So, they have low tendency to stay intravascular. Principal component is inorganic salt sodium chloride. Volume resuscitation with crystalloid fluid expand interstitial volume. They also increase interstitial volume rather than plasma volume. They increases intravascular volume, but they also increase interstitial volume because they leak out. Examples are normal saline, dextrose, and lactated ringer solution. Now, what are the advantages and disadvantages of crystalloid solution? Advantages: they do not produce allergic reaction. Allergic reaction is rare with crystalloid. They are inexpensive, they have low cost, low effect on blood coagulation. What are the disadvantages? They have short duration of action, 30 to 60 minutes, and they are required in large quantity. Opposite to colloids, colloids they are required in small quantity, crystalloids are required in large amount quantity, almost 3 times. They freely cross capillary wall, so less fluid remain in intravascular spaces, and excessive use can cause edema. So, normal saline, we all know it is isotonic fluid, osmolarity equal to that of extracellular fluid, 0.9% of the sodium chloride. It is a sterile non-pyrogenic solution for fluid and electrolyte replacement. It is used in hyponatremia, should be avoided in heart failure, pulmonary edema, and renal impairment. It may cause fluid overload. It may cause fluid overload. Dextrose, it is hypertonic fluid, uses 5% solution, plasma volume expansion is minimum, it gets metabolized and water get distributed in all compartments. Infusion of 1 liter dextrose can raise the plasma volume by just 100 ml. It is injected slowly. Last in this is ringer lactate solution, is again isotonic with blood. It is used for balancing fluid and electrolytes and as an alkalinizing agent, sodium chloride, sodium lactate, potassium chloride and calcium chloride. So, this here you can again compare crystalloid. We have already discussed comparison between the crystalloids and the colloids. So, you can again review it. So, these are the different references from where we have taken the concepts. So, thank you all.